Hi everybody. I hope that you all can see and hear me. We'll be getting started in just about 2 more minutes. We're just waiting for everybody to join, and at the same time I'm just figuring out all of my technical things. As we know, transitioning to working from home and working from an office and putting all this technology together can be challenging. So we may not know 100 things about technology, but I tell you what we do know: Medicare. So I'm going to play around with my technology for just a couple more minutes while we wait for more people to join. It's great information. So if I'm not looking directly at you guys or engaging, just hang tight, get yourself a sip of tea or water and coffee, whatever it is at this time of the day for you, and give me a moment. Okay, let's see. Screen. Not sure. Leslie, if you're there, can you tell me if you can see my screen that says Medicare Supplements versus Medicare Advantage? Okay, let me see. If not, it's okay. I was trying a new program and not sure if I was able to do it. I was hoping, let's see, video clipping polls and more. I was just trying to see if I can get this screen to work. I don't think it's there. Screen. Okay. All right, well, let's give it 30 more seconds and then, okay, you cannot see my screen. Leslie, I don't know how to do it. I'm on the B.Live and I had a presentation next to me, or at least an agenda, and I can't share it. I don't know how to. I thought I did. Okay, well that's okay. We're going to go ahead and move forward. So, let me see. Let me try one. Nope, that's not going to work either. Okay. All right. So let's go ahead and get started. So I hope everybody has been able to click in and sit back. And if you want to take a pen and paper, or if you want to just kind of listen as I go through some some notes, it's very good information. If you are turning 65, if you are helping somebody who is turning 65, or if you're helping your spouse, you're helping your parents, or if you are 65 and you already made a decision and you decided on a plan and you're kind of wondering, you know, what other options did I have? I really didn't have a clear understanding. I needed to make a decision, and I made that decision, but I want to kind of verify and double check if it was the right one. That is why we're having this conversation, and that's what our agents like to do with you. So when you talk to any of our licensed sales agents or Medicare coaches, you can expect to have a conversation, not something where we're going to just sell something over to you over the phone. We want to have a conversation about where you are, what your expectation is, and we're going to do that match for you. So let's get right into it. So Medicare Supplements versus Medicare Advantage. I'm going to pull up my agenda here. I'm sorry I can't share it with you guys. I tried with this technology. Again, like I said, we may not be wonderful at grasping all the technology as it's coming on faster, because especially with the climate of our world today and everybody moving into it. But one thing that we do know is Medicare. That is what we specialize in. So don't mind that I can't function the technology completely behind it. I am a little old school. All right. So Medicare supplements versus Medicare Advantage. And that brings me to the very, very first question, okay? What is a supplement plan? Well, we've been talking to beneficiaries over the phone, over the phone since like 2010, and we were in the field before that. That means we were, kneecap to kneecap at the kitchen table, and we'd always have someone say, "Oh, I have a supplement." We're like, "Great. What is it? What do you have for supplement?" And they may have QMB, which is Qualified Medicare Benefits. It's a form of Medicaid. It's a state benefit that helps pay for Medicare. Technically, that's not a supplement. It does help with the cost, but it's not a Medicare supplement. And then they might say, "Oh, I have a dental plan from work. They let me keep it, and a prescription plan from work." That's still not a Medicare supplement. And so a lot of people have an idea of what a Medicare supplement is, but they don't understand what it really is. So a Medicare supplement plan is known as a Medigap plan. A Medicare supplement is Medigap. So those two words you'll hear interchangeably depending on the age of the person you're talking to. Again, everybody says supplement, but a Medicare supplement is, in its truest form, it's a Medigap plan, which means it picks up where Medicare steps out. So what do I mean by that? Well, now we got to pull our reel back in a little bit, right? Bring in the fish a little bit, let's pull it back. We have to understand original Medicare. Remember, original Medicare is Medicare A, hospitalization, and Medicare B, which is your medical part of your insurance. That's your doctor's appointments, your inpatient hospital, certain vaccinations, certain medications, if like infusion, chemo, those things fall under Part B. Durable medical equipment, all those things fall under B. Medicare Part A is your hospital, your skilled nursing, home health nurse that comes out to see you, because it would be as if you were in the doctor's office visiting the nurse. So that all falls under A. B is medical, A is place. So original Medicare Part A and B will pay 80% of approved services. So I'm going to say that word again, 80% of approved services, which means if you have a procedure done that was not Medicare approved, people always automatically think of cosmetic surgery. It may not have been cosmetic surgery. It may have been something as simple as a hernia. Yeah, it's because you think, okay, well, I have a hernia, I need to go and get surgery. Not always. Sometimes the doctor will say, okay, we can do a surgery to correct the hernia. It would be elective surgery, and you're like, yeah, let's do it. And you say yes, doctor says okay. They bill it to Medicare, Medicare rejects it because they didn't find it medically necessary. It could have, been kind of manipulated back into its split place. So that invasive surgery, you would be 100% responsible for that. So approved services means that the doctor and Medicare agree that this is medically necessary, and it falls under Medicare's guidelines, right? Not the cosmetic surgery. And Medicare pays 80%. So what happens to the other 20? Well, that becomes your responsibility. If you're thinking on a scale of $100, then it's not much. Thinking on a scale of $1,000, okay, $200. But what surgery do you think you can get done for $200? Heck, you can't even get dentistry done for $1,000, right? So let's think about this. If someone was to go in the hospital, let's say it's an emergency, and they end up in the hospital, they're very, very sick, you're vomiting, you have diarrhea, you spiked in a fever, guess who's not going to see you? Your doctor. Your doctor's going to say, okay, you need to go to the ER. This sounds like something you need to handle over there. Once you hit a certain age, they definitely want you right in the emergency room, because it could be so many things. It could be your appendix, it could be your gallbladder, it could just be something as simple as the flu. And this actually is a true story. I had a client. She went into the hospital just for those very reasons. Chills, high fever, went out for 2 days, vomiting, diarrhea, you name it, she had the works, right? And we called the doctor's office, and they said, nope, ER. Go to the ER, and they said, you have the flu, but we looked at your chest x-rays, and you also have pneumonia. Wow. Okay. So we're going to have to admit you. Big key word, admit, because this is how this Medicare supplement is going to come in, right? But we're talking about original Medicare. So she was in the hospital for from December 26th until January 3rd. What is that, 7 days? Something very little. No invasive surgery. None. No invasive surgery. MRI, one of those. 2 x-rays. A lot of IV bags, you know, for antibiotics and fluids. And a lot of blood draws. Okay? 5 things. No invasive surgery. Discharge sent to skilled nursing. The bill that came in was $86,000. It's a lot. Again, we didn't do any surgeries, right? It was just x-rays and MRIs, blood draws, and IVs. $86,000 billed to her under original Medicare. Now let's do 20% of that. Okay, so now I know you're following me. So that's what, approximately 17,000, somewhere in there. That's a chunk of money. And if you're retired and you're living on Social Security and you have your 401k saved up, your IRA, it doesn't matter. Who wants to pay right off, you know, any 20%, right? It's a bit of money. So luckily, this individual had another plan to kick in where Medicare left off. And that's what I'm talking about with the Medicare Supplement. So a Medicare Supplement will step in and pay certain things that Medicare does not cover when it comes to that 80%. Now, we've all heard of, you know, Medicare plan. Now, remember, part is A and B. That's Medicare. When we say plan, we're talking about the Medicare supplements, right? We're talking about the Medigap. So there's a plan A. There's a plan, I think B went away. I'll pull up the chart in a minute. Plan G, plan N, plan C. Now, there used to be a plan F. Now, if you yourself are already on Medicare and you have a plan F, you can change your plan and still get a plan F. Let's say if your premium went up, you can still get a plan F. But if you're new to Medicare and you became new to Medicare after the year 2020, you cannot. It's not available to those who are new to Medicare. But I just want to clarify that if you have original Medicare and you have a plan F, you can always get a new plan F if you want to check and see if you qualify for a lower premium. So I just want to throw that out there for you guys. So your plans, your Medicare plans, there's many to choose from on a supplement, and I'm going to go through not only what the supplement is, but what it is meant by standardized, and what are the benefits of having a Medigap plan, and then we're going to transition the conversation into the Medicare Advantage. But before I do that, I'm going to go into Medicare.gov. And that's a great resource for you guys, and I wish you could see my screen. Again, I tried. So the Medicare.gov website has tons of information, and that is why we promote that we simply speak Medicare, because it's a lot of information. If you're new at this, it's a lot to digest. And so we have taken a lot of years of experience working with people, working amongst each other, and making it simple so we can share this information simply to you guys. So I want to go into, if you're in Medicare.gov, I just go into supplements and other insurance, and then I go into how to compare a Medigap policy. And the reason I'm doing this is because I can't remember all the letters. There's a few of them. I have to remember so many things. So let's talk about alphabet soup, right? Okay, so Medigap plans. There's a plan A, a plan C, plan B, plan D, F, G, KLMN. So again, now G has been kind of the plan that people have moved towards because plan F is not available, and I think that plan B is no longer available. Let me make sure. Let me see. Plan C and F. C and F. So C and F are no longer available as of 2020 for people new to Medicare, and the reason is because those two plans, just those two, paid the original Medicare Part B deductible. If you remember, for 2020, I think the Part B deductible on the original Medicare is $198. Plan F and Plan C paid for that Part B deductible, but now it does not, it's not available. So Plan F and C. Now, if you have those plans already, again, you can switch to another C or F if you want to challenge the premium increase you may have received recently, because we know in June they give premium increases. But if you're new to Medicare, Plan C and Plan F are not available to you. So, Medigap plans. It's known as a Medicare Supplement. There's Plan A, Plan B, Plan D, Plan G, Plan K, L, M, N. Now, what's the benefit of these plans? What does it mean by standardized? Why would I choose a Medicare Supplement, and how much do they cost, right? Everybody wants to know how much do they cost. So let's go back to original Medicare. Original Medicare has, if you worked for 10 years and paid taxes for 10 years, or if you were married to somebody who worked and paid taxes for 10 years and you were married to them for 10 or more years, that's the key thing, that you had to have been married for 10 or more years, then you qualify under their benefit. Now, Medicare Part A would be premium free at that point. If you didn't work the 10 years, you weren't married to somebody for 10 years, you're going to have to put in more, what we call quarters, okay, more work quarters into taxes basically, or pay the premium, and it's pretty hefty. It's over $400. But most people receive Part A premium free. Now let's talk about Medicare Part B. There is a deductible. For 2020, it's $198, which means you pay the Part B deductible, and then after that, you pay 20%. Now, if I have a supplement plan, I will go to the doctor, and let's say I chose that Plan G, okay, because it's the one that kind of wraps around original Medicare and says, we got you covered except for the Part B deductible. We're not going to pay that. Everything else we're going to pick up. So you go to the doctor, hospital, if you were admitted. Remember, that's a big thing, admitted and observation, but that's another video. So you're admitted to the hospital, you're in there, and you give them your Medicare information, and then you slap down that supplement card, your Medigap card. I don't know what carrier you're going to choose, and we'll talk about that in a minute, but you give them that card, they're going to send that and put it on their file, so when all the bills come in, right, Medicare pays 80% of the first part of the bills, and then they're going to take the rest of your bills, the 20% that you're responsible for, and they're going to bill that to your supplement plan. And your supplement plan is going to pay the remainder of the bills on your behalf, except for the first $198 for 2020, which is the Part B deductible. So that's how a Medigap plan works. Now, if you have, that's a G, that's a Plan G. If you were to go with a Plan N, okay, it's going to cover, let me see, it covers the Part A, not the Part B. It doesn't cover what they call the Medicare excess charge. That means a doctor can charge 15% more over the cost of original Medicare suggested cost. A lot of doctors don't do it, but they have the option to do it. And covers skilled nursing, Part B insurance co-payment. I can't remember what the biggest difference between the G and the N is. That's why you got to speak with one of our licensed agents, because they know the knit and grit between these. But what I want to talk to you about is when you do decide, I want to Plan G, I want to Plan N, I want to Plan B, I want to Plan, don't go with A. It has the least benefit to you, and they're the most expensive in premium. Or I want to Plan M. Whatever the case is, what I want to emphasize to you about a Medicare supplement plan is that they are what we call standardized. Standardized means that a Plan G is a Plan G, a Plan N is a Plan N, a Plan B, a Plan A, a Plan L, M, N, O, whatever letter you go with. It's the same no matter which carrier you go with. So for an example, if I said, hey, on your way home, I need you to stop by the store and get me some avocados. We know avocados are a little costly, right? Okay, but they're good on a salad and they're good for you. And I say, I need some avocados. You're on your way home from work and you're coming home. You're going to pass by this grocery store, that grocery store. You're going to pass by 4 grocery stores. All I said was, get me some avocados. You're going to decide which store you want to stop at. It's your choice. Now, in Houston, that's where I am, I know that this grocery store is going to charge me probably $1.24 per avocado. And that's not the big one either. That's a regular one. If I go to that store over there, they're 78 cents a piece. But if I go to the local farmer's store, which I just love farmer's stores because they're local, I can get them 2 for $1. So where am I going to go? I'm going to go get them a 2 for $1. But guess what? When I go home and I say, hey, honey, here's the avocados you asked for, at the end of the day, it's an avocado, right? Well, that is exactly how a Medigap plan works. A Plan G is a Plan G. A Plan N is a Plan N. The benefits of the plans are standardized. They're the same. So all you need to worry about focusing on at that point is which plan or carrier do I want to go with. You can do that by rating, and we do not represent a carrier that has less than a B plus rating. B plus and above is all we represent. If they hit that B negative and below, we're not going to even offer that plan. Okay, just so you guys know. If you, yes, 2 for $1. I'm in Houston, Texas, close to Mexico. So I was surprised at the cost. So yes, at the end of, whenever I choose that plan, I can choose whichever grocery store or carrier, and I'm going to base it on premium. Premium, why is a premium so much over here and so much and so less over there? Well, it's the same as a grocery store. You're paying for their display, their advertising. How does the insurance company spread the cost of advertising? They put that on you, right? That's how it works. So when you're shopping around for your Medicare Supplement plan, speak with one of our licensed agents, because what they're going to do is they're going to open up what we call like a quoting engine, and we can pull up your zip code, and trust me, zip code matters. Wow. I had an appointment a few years ago with somebody, and I knew that she lived only 1.5 miles from my grandmother, and I didn't know her zip code, so I plugged in my grandmother's, right? I was like, oh yeah, we got a plan over there, and goodness, it's so inexpensive. It's like $141. And now this is in a different area. Every zip code matters. I don't want to get you to focus on cost, but just to hear me out. When we got to her house and we were going through the plan, and we pulled up the actual application, and we inserted that, I'm sorry, we do work from home, and we inserted the actual zip code. Give me 1 second. Hang on. Nicholas, come get Teddy. Hurry. Come here, Teddy. Hurry. Put him in your room. Get the dog. Put him in your room. I'm on a video. Okay. Sorry about all the noise. We do work safely from home. We just do. All right. So back to the service. So we put in the actual zip code, and that plan jumped from 141 to 193. The same carrier, the same plan, the zip code mattered, because that just meant that they had a lot of claims from people who lived in that particular part of Houston. So when you talk to someone, we want the zip code where you live more than 6 months out of the year. If you're a traveler, and let me talk about that. No, I'm going to hang on to that. So a supplement plan, it picks up where Medicare leaves off. How much does it pick up where Medicare leaves off? That's going to depend on which letter you choose. The Plan G, the Plan N, the Plan B, the Plan K, L. Okay, we see on Medicare.gov there's like 11 of them to choose from, so that's going to depend on you. So the coverage level, right, the 20%, how much of that they're going to eat up for you, will depend on your decision, what you need it to cover, and then, of course, premium is a consideration. So again, when you're looking at the premium, at the end of the day, an avocado is an avocado. It depends on what store you want to shop at. And remember, the higher the premium, it doesn't necessarily mean it's a better company or a better plan. It just means that they're pushing some of that advertising cost onto you, some of that marketing cost, the presentations, just like you do in a grocery store. And so that is why we always encourage you to speak with a licensed coach, because when we pull up that quoting engine, again, remember, we will not represent any company that is less than a B plus rating, okay? Now, the Medicare Supplement, we know that we have our original Medicare A and B, and we have a premium for Part B. Every year there's a premium, and that premium will increase annually, typically on January 1st, right? You get a COLA notice, hey, Social Security is going to give you a raise, and then Part B gets a raise too. Happens all the time. It's just the way things work. But you pay your Medicare Part B premium, and then you have your 80% of your Medicare approved services paid for. Now we're going to focus on this 20%. So what we do is we get that supplement plan, and we pay a premium to them. And that is how it works. So you have your Medicare Part B premium. Hopefully you don't have Part A, but again, that's another video. Most people don't have a Part A. So you have your Part B, Then you have that Medicare Supplement premium. And at the end of the day, everything is covered. Everything that, well, depending on the coverage level you chose, but in most cases, everything is pretty much covered. One thing Medicare supplements do not include, though, is prescription drugs. There's a catch to that. You might not take a lot of prescription drugs, you may not take any, or you may be someone who needs to take a lot of prescriptions. Maybe you have a chronic disease, and that is why you chose a supplement. And I'll get to why people choose these in just a minute. But you need to grab a Medicare Part D plan, D for drugs, to go with the Medicare supplement. And those are not very expensive depending on the type of formulary you're looking for. If you don't take a lot of prescriptions, you can get a small plan in your area. They're very little. If you don't take any prescriptions, I'm going to recommend that you not choose to disregard getting a Medicare prescription drug plan, because if you don't get it when you're first eligible, Medicare will penalize you down the road. If you don't need it now, and you're like, I need it now, okay, 3-5 years later, I need to get that, they're going to penalize you, which means that you're going to have a penalty or like a fine you pay every month and it never goes away. You know, it's kind of like having driving a car without insurance and bumping somebody, and then you get the insurance later. Well, you're supposed to have the insurance before the accident, so they see it the same way, right? So you would have to get a Part D. So a lot of people want to know, well, how much is a supplement? How much is a Medigap policy? Well, it really depends on your service area, which is your permanent zip code. So again, if you're a traveler, and I'll talk about the benefit of that, but we see them, you know, like let's say you get a high deductible, and the agent will explain the difference between a high deductible and a regular one. Like the Plan G has a high deductible option. It's the only one I know of that does, unless you have a Plan F already. And so it has a very low premium, $40, $60 a month. But the average Part G plan for someone brand new to Medicare, we see them pop in around $96, $105 per month on top of your Part B premium. Now again, over the years, that's going to increase, so little by little. And that's when you want to start shopping around in July. Once you get your notice, hey, there's going to be a small increase, but that's you know, just like your house insurance. I just got a notice mine went up 30% and I didn't have a claim, right? It's just nature of insurance. But why would somebody choose that, right? Well, if I'm paying Medicare Part B over here and I'm going to have a Medicare supplement, why do I want that if I have to pay an extra premium? Well, how much do you want to pay for freedom? And what do I mean by that? With a Medicare supplement plan, you can choose any doctor that accepts Medicare. That's very important you know that, because if your doctor doesn't accept Medicare, and this is a true story, we have actually, I'll tell you who it was because it's not too personal, the principal of our company, right? The guy who founded our company, he's been part of his doctor's network forever, okay? Like, most people have lifelong doctors. So he was going to this doctor for year over year over year. And I don't know why they didn't tell him as he was approaching his 65th birthday. They didn't notify him. He went in for an appointment and they said, we can't see you anymore because we are not Medicare appointed. And he was like, I don't understand what you're telling me. And they said, we can't see you anymore because now that you're on Medicare, we don't accept any Medicare patients. We don't see Medicare patients. We only accept group insurance or private insurance, but we don't accept Medicare. So basically he got fired from his doctor, right? He had no idea the doctor didn't take Medicare. It's not like they had a sign in the office. Or they sent him a letter, hey, you know, so-and-so, just letting you know, heads up, we're going to have to, you know, we recommend these doctors because you're turning 65, we don't accept Medicare, but here's a list of doctors that we do work with, or something. There was like nothing. It was so cold. That's awful, but that's doctor news. So I want to recommend that if you're in a group plan, or if not, and you're coming new to Medicare, be sure you know if your current physician accepts Medicare. And if not, who does your current physician recommend? Because doctors, they do network, right? They all do. Not like car salesmen. They actually network. So please make sure your doctor is Medicare appointed, which means they have the right to accept a Medicare patient. So back to what I'm telling you. A Medicare supplement plan, people will pay for the freedom. So especially you folks who are living in the north and you travel down to the south for the winter, you might come and live in Florida, Corpus Christi, Padre Island, Mississippi, I don't know, anywhere by the coast. Or how about the opposite? What if you live here in the winter and you head back up north for the summer because it's hot down here. I think it's 105 degrees right now. I'm not for sure, but I mean, my ground is melting. It's hot. So you might travel, a little more north there in the summer here if this is where you live. But we need your permanent zip code when we run those numbers. But with the Medicare supplement, you get to go to any doctor anywhere in the U.S. Anywhere. And they do have, some of them do have what we call worldwide travel. Now, I know most of us aren't really worldwide traveling, okay? But you get on a cruise ship, you get on a plane, there is a level of security knowing that if there's an emergency and you're not close to home, right, you're traveling, you're going to have some coverage. So the Medicare supplement allows you to choose any doctor or hospital that accepts Medicare. So to wrap up the Medicare supplement, before I go into the Medicare Advantage, let me just close this one out. A Medicare supplement is known as a Medicare Advantage plan. I really wish I can share this screen with you guys. It's okay. I hope I'm entertaining enough. I use my hands all the time. All right, so a Medicare supplement plan is known as a Medigap plan. So not anything and everything is a Medicare supplement. QMB is not a supplement. Medicaid is not a supplement. Medicare Advantage is not a supplement. A Medicare supplement, known as a Medigap, that is a supplement. How does it pay Medicare? When Medicare stops, that plan will pick up. Which plan? That's up to you. You can choose whatever letter you want. The letters are standardized. The benefits are the same, just like I had the story. The avocado is an avocado and an apple is an apple. At the end of the day, the premium is based on your zip code and the carrier, which is the company you choose. Just because it's more expensive doesn't mean it's better, because remember, the cost of advertising and marketing usually rolls back into the premium and applied to us customers, okay? I mean, which commercials do you see on TV the most? Think about it. All right, then, once you get that plan, depending on the coverage level you chose, whether it's G, L, M, okay, whatever letter you chose, you want to get a prescription drug plan to go behind that, okay, because you're kind of layering. You got original Medicare, your Medicare supplement, and then your Part D, D for drugs. You've got a complete package. The only other thing I would add to that, ever, would be a dental plan. You definitely want to think about that, because a Medicare supplement does not cover dental, because Medicare doesn't cover dental, okay? Unless you're in a severe accident or you have some type of disease that chews away at your jaw or makes your teeth fall out and it has to be Medicare approved, you're not getting dental coverage with original Medicare. So if original Medicare doesn't cover it, your Medicare supplement's not going to cover it, okay? But you have original Medicare, and then the cost is shared with that supplement plan, and you got your drugs covered, and even if you don't need them, get a very inexpensive plan, because depending on the formulary, you can get a very cheap one until you really need to increase that formulary. And then the only other thing I would add to that would be like a dental plan. There are other plans. There's cancer. I didn't even talk about cancer plans, but that's not part of Medicare. But most of the people coming from a group plan that we speak with, they do opt for the dental and the cancer because it's a layer of protection. If you get diagnosed with cancer, Medicare is going to pay what it pays for, right? But if you know somebody who's had cancer and they're like, well, my doctor did this and this and that, and then we tried this new drug, it's still under, I was part of a placebo, and it came out positive that this worked, and then you are diagnosed with cancer and you're like, I want to try that. Well, if it hasn't been approved by Medicare, you're not getting that treatment. That is why people choose cancer plans. So just put that thought in the back of your head. Okay. Now, so why do people get the Medicare supplement? Because they get freedom of choice. They get to choose any doctor or hospital that accepts Medicare. Now, you have your original Medicare, Part A and B. B premium, A is typically premium free. You have your Medicare supplement premium, usually very low, especially when you turn 65. Find a very low prescription drug plan if you don't have a chronic disease, and then you're free to move about the country, right? So again, it doesn't cover dental, it doesn't cover vision or hearing. I can't think of all the other fun things it doesn't cover, but it does cover your expenses, and that is what we're searching for. What's going to save my pocketbook, okay? Now, if you have any questions about a supplement, I want you to type them in or call our number and talk to one of our folks, and they're going to help work that out with you, okay? They're going to help you understand more about them. But I'm going to move into Medicare Advantage, okay? Now, a Medicare Advantage is very different than a Medicare Supplement, but they're very popular. What is a Medicare Advantage plan? Well, if you guys can remember way back, I mean like in the 90s, they came out with something called Medicare Plus Choice. Yeah, okay, so some of you guys might remember that. Medicare Plus Choice. So over the years, this has become known as Medicare Advantage, but we call them Medicare Part C. Medicare Part C. And if I was to visualize it, I think of Pac-Man. You remember Pac-Man? It takes A, B, and D, in most cases D, and it just chomps it all up and takes it all in. So with the Medicare Advantage plan, what happens is you apply for your Medicare, your original Medicare A and B, you pay your Part B premium. You'll always have to pay that unless you qualify for help, and we will help you do that. If you're not sure, if you feel like these things we're talking about are expensive, unaffordable, you're just going to go without insurance, don't do that, please. Don't do that. Talk with us. We will help find out if you do qualify for Medicare Advantage. We will find out if you qualify for QMB, which helps pay for some of these expenses, and the Medicare Part B premium. So don't ever think Medicare is too expensive, because if you think that, then we may be able to get you help. Call us. Okay, so Medicare Advantage, Medicare Part C back then, Medicare Part C now, Medicare Plus Choice way back in 3 decades ago. Now, here we are. Medicare Advantage, like I said, think of Pac-Man. When you have original Medicare A and B, and you're paying your premium, you got that 20% responsibility, right? You said, okay, I like the idea of a supplement, freedom of choice, okay, but I'm not really comfortable with this premium going out every month. Well, do I have another option? You do. It's called a Medicare Advantage. So when you get a Medicare Advantage plan, you're going to go with another private insurance company, because supplements are also private insurance carriers. They have a contract with Medicare. Well, Medicare Advantage is the same thing. It's a private insurance company with a contract to Medicare. Now, the Medicare Advantage plan says, hey, tell you what, we are going to take over your Medicare responsibility, your Medicare expense responsibility. And I want you to think for a minute. A lot of times, this has happened so many times, someone will go into the doctor's office and they present their Medicare Advantage card. Now, let me back up for a minute. When we talked about Medicare supplements, remember in the hospital you give them your original Medicare card, all your information, and you pass them over that Medicare supplement card. They bill Medicare, they get the invoice back, here's the remainder, they bill the supplement card. With Medicare Advantage, it takes over the billing of Medicare. It takes over the responsibility. They don't send anything to Medicare. So if you have a Medicare Advantage plan and you go in the hospital, you give them just that carrier card, and it has a member ID number, and it has your name, and it has your group number. And you give that to your doctor or to the hospital. And if they're in network, okay, hold on to that thought. If they're in network, you want to make sure you're in network unless it's an emergency. You hand them that card. They don't bill Medicare at all. They bill that carrier straight. And the carrier will look at the bill, and they will tell the physicians or the hospital, okay, we got all this covered here. This is the copay. And I'll go back and review that in just a minute. I'm just trying to tell you how it works. So now you have your Medicare Advantage plan. What I'm explaining to you is that they don't bill original Medicare. A Medicare Advantage plan does not pick up where Medicare leaves off. Instead, it pays for your Medicare approved services at the contract rate agreed by that network physician and the network hospital, okay? Which means you will have a small copay. But in exchange for a small copay, you may not have a monthly premium. You may not. We see plans that have very little monthly premiums, and we see some plans like a PPO that may have a higher monthly premium, but it won't be as high as a supplement. So it depends on, again, where you live and which carriers are available. Now, I want you to understand something. This has happened several times. This is going back to what I was saying a minute ago. A lot of people have gone into the doctor's office, and the nurse or the receptionist behind the door takes the card, and they say, oh, you have a Medicare replacement plan. Oh, I hate that. It's not a Medicare replacement plan. It doesn't replace Medicare. You always have Medicare. In fact, you cannot have a Medicare supplement plan, and you cannot have a Medicare Advantage plan if you don't have Medicare. So when they say, and I'm just telling you this so you hear it now and you understand it later if this is your option, because again, these choices are up to you. And we'll talk about that too in a minute. But when someone says you have a Medicare replacement plan, don't ever think you lost your Medicare, because that's not what happened. All that means is it took over the responsibility of billing Medicare. They're going to pay that physician the contract rate they promised to pay. That's all that means, okay? All right, so let's move forward. So a Medicare Advantage plan takes over the responsibility of paying the Medicare Part A and paying the Medicare Part B costs. And then in most cases, there's a prescription drug plan attached. That's why I think of Pac-Man, right? It has a prescription drug plan included. Now, if you're a veteran and you use the VA, if you're a veteran and you use the VA and you want one of these Medicare Advantage plans, you can have one. And there's a lot of incentives for a veteran to have a Medicare Advantage plan because there's a lot of benefits to it for you. But I do want to say this. Always have original Medicare, whether you're a veteran or not. Whether you use the VA or not. If you use the VA and you don't use the VA, you still need to have Medicare, original Medicare, because if you end up in somewhere or some hospital for some reason not related to what the VA covers, you're going to be at 100% responsibility. So that's for my veterans. But for my veterans that are using the VA but want to have the option to go to a civilian doctor outside of the VA, you can do that with a Medicare Advantage plan. And you don't have to take the drug option. Okay, so if you're a veteran, you're using the VA, you're getting your prescriptions, you can get a Medicare Advantage plan without the drug option, and there's some little perks to that. I can't go over it in the video, but you can talk to one of our agents and they'll explain. It's a big perk. But if you are a veteran using the VA or not, you really need to have original Medicare. You have to. It's not required. But even the VA will tell you you need to have original Medicare, because if not, you end up in something and you don't have any coverage, you're at 100% responsibility, okay? Now, let me go back to everybody. The Medicare Advantage plan takes over the billing of A and B, and in most cases includes prescription drugs. Now, if these are low premium, or in some cases there really isn't a premium expected monthly, all I have is my Part B premium, because you're always going to have Part B premium unless you qualify for assistance. Why would I choose this over a Medicare Supplement? Why? A Medicare Supplement, is great and has a monthly premium that may be more. So why wouldn't I choose this if it's less? Because you're going to be working with a network. Your Medicare Advantage plans work within a network of doctors. Now, there are PPO options, and there are plans that do have a point of sale, which means you can go within the network, or you can pay a little bit more and go outside the network. So you have that flexibility if it's available by your zip code. Medicare Advantage plans are very, very, very concentrated by zip code. So what may be available in your zip or county may not be available in the next zip or county, okay? They also have enrollment windows. I didn't explain it much on the Medicare supplements, but with the Medicare supplement, you can change your plan in most states throughout the year. Not the prescription drug plan, but the supplement plan, you can usually drop and change year round in most states. And we're in all 50 states, so I'm not sure what state you're in, so most states. A Medicare Advantage plan doesn't have that kind of flexibility. You have enrollment periods. So it could be when you first turn 65, you may have to wait till the annual election period, you may have to wait until you lose group coverage, or if you move, or if another plan enters the area, or your contract ends, that contract ends with Medicare. There's many different things. There's a lot of windows, but you have to qualify for that window in order to make that change. But there is always an annual window when it comes to Medicare Advantage. Now, why else would say, okay, if I have to work with a network of doctors, okay, maybe you live in a big community and they have a big medical center and you have plenty of doctors to choose from. You don't need that freedom of choice. That's great. You can choose a Medicare Advantage plan if that's right for you. Now, what you do have with a Medicare Advantage plan that you don't have with supplements is a copay. With some of the supplements, you may have a small out-of-pocket copay, but with almost all Medicare Advantage plans, at some level of service, right, like a specialist or a hospital, almost all of them, you're going to have a copay, which means if you go in the hospital, there's a copay. but it's certainly not the Part A deductible, right? Certainly not that much. A lot of the plans don't have a copay to see the primary care physician, but you'll have a small copay to see your specialist or outpatient surgery. That is how those work. Small copay, low premium, and it comes with drug coverage. Now, the drug coverage does have a formulary. So when someone is choosing a Medicare Advantage plan, you not only want to look at what's available in your area by physician, but the formulary. So if you're someone who has a chronic disease, whether it be diabetes or congestive heart failure, in some zip codes, there's a plan that's made just for people who do have diabetes, where they give you a couple of extra things that someone who doesn't have diabetes wouldn't need. I mean, the benefits are pretty vast in these plans, and it really depends on carrier, and it depends on zip code. But a lot of the plans include dental care, whether it be comprehensive for some it's just preventative, but that's a little step above than what original Medicare offers, right? Some will offer a vision care service. Some may offer a gym membership, and right now that's going to be a virtual gym. Or they may say, hey, you can get this exercise watch. You know which one I'm talking about? I can't really name names, but the kind that tells you how many steps you have, your heart rate, how well you breathe at night, that kind of thing. So some include that. We even have plans that have the personal response system at no cost. Like, hey, I've fallen and I can't get up. Some of the carriers, the plans have added that. And we've even seen acupuncture come across the board on a few of these. Now that's crazy, because where I live in a very concentrated Asian community, and that's like a big thing here. And I mean, there's one on every corner. And Medicare, we're not going to cover that. But in some of these plans, it's part of their package. It just depends. It depends on what your needs are, where you live, the carriers available in your area. Now, let me talk about these copays. They have what is called a MOOP, M-O-O-P. One thing you'll learn about CMS and talking to any of us, there's a lot of acronyms, and we really break these down. CMS is Centers for Medicare and Medicaid Services. MOOP, maximum out of pocket. So basically what that is like a cap. So I'm going to use my cup. Okay, don't worry about the soda names on here, because I get these from restaurants when I can. All right, so let's say you have a Medicare Advantage plan, and it has a MOOP. Let's just start a number. Let's say the MOOP is $3,000, right? MOOP. It's not a deductible, okay? Don't confuse that. It's not a deductible. Before I go into this, understand a Medicare year starts January 1st, and a Medicare year ends December 31st. What that means is the plan's benefits for the new year begins January 1st, and those benefits end December 31st. Now, if you're in a plan, you don't have to do anything. The plan will renew automatically, just like your auto insurance. It just removes automatically. And if there's any changes to your plan, they'll send you a letter in the mail in September. It's called an ANOC, Annual Notice of Change, and that's going to tell you what to expect January 1st, right? This prompts you to keep your plan or to change your plan. Okay, not going too deep into that, because that's another video. I'm going to talk about these copays. It has a maximum out of pocket. It's a cap. So, I'm going to put my little paper here, right? Oh, you couldn't see my cup. Oh, okay, we'll use my phone. All right, here's my cup. Let me get it to you. There we go. All right, so here's my demonstration. You get your plan, and let's say January 1st, right? January 1st. Your plan began. And you're doing good, You go to the doctor. Yeah, you had a copay here. You went to a specialist, and you had some lab work done. You may have had a little visit. Then you got admitted to the hospital. You had a copay. And then you got out of the hospital and you went to skilled nursing, and then you had to get occupational therapy, physical therapy, speech therapy. You had to get all the therapies. You go home, you're good, everything's good. You go back to the doctor and they find something else. Oh my goodness, we're like cars, right? We keep breaking down. So now you have a copay, you have a copay, you have a copay. Let's just say you have a really bad year. It's 2020. Can we say that? I don't know, is that compliant? I'm kidding. Okay, it's 2020. It's a bad year. Now you're diagnosed with something. I'm not going to say the C word, but now you have to go through a lot of drugs, and there's some copays and labs, and you have to get some blood fluid, some more blood pints, whatever it is. But every one of these services had a copay. Well, you had a copay for each visit. It's not a deductible, right? You don't pay it up front. But what happened was you had a really bad year. So when you hit and they're like, hey, Sandra, we noticed that you've had some pretty devastating medical issues, and you hit your maximum out of pocket. You have spent over the course of a year, or almost a year, it's only October, you spent $3,000 in co-pays for your hospitalizations, your therapy, your radiation, whatever it is, whatever workup they had to do on you, we got you from here. From here until the end of the Medicare year, which is what, December 31st, you got a cap. You are not responsible for any more co-pays for any Medicare approved services. That's keyword, Medicare approved services. That is the benefit of having, whether it be a supplement plan, because you pay your premium and then they pay everything after, depending on the coverage level you chose. And with the Medicare Advantage plan, yeah, they have co-pays, but they also have a cutoff where it says, hey, we don't want any more money from you. We're going to pay for everything from here on out. I actually had that happen to two people. One had a really bad year. She broke her arm, she broke her wrist, they misaligned it. Her hand, let me see, her hand looked like that. So you know what they had to do? They had to re-break her hand, put it straight, and she had to go through a lot of physical therapy to get her hands to work properly. And then she had a major accident, and it required a lot of workup over here. She had to go back through physical and speech therapy. She survived, okay? She did end up spinning up to her MOOP, and she's walking and breathing. She can't smell or taste, but she's walking and breathing, so she's good, right? But it protected her finances. So what I'm going to do now is I'm going to ask you the question. Okay, I understand a Medicare supplement gives me freedom of any doctor that accepts Medicare. I pay a monthly premium for this freedom, and I can use a plan anywhere in the nation. I have some coverage in an emergency if I'm traveling. I get that. And I have to get a Part D. If I choose a Medicare Advantage plan, I may have a very low premium. I might have a small copay. It does have a cap, which means I don't have to put any more money out. The plan will cover me regardless until the end of the year. It comes with prescription drugs, but I have to use their network of doctors unless I choose a PPO. In that case, you may have a small premium. I don't lose my Medicare rights or benefits because I always have original Medicare regardless which way I go. So which one is best? Well, that's the most common question we get. Which one's best? What do you think I should choose? Well, we can't answer that for you. We can't. It's almost like saying, hey, how does my rear end look in these pants? Yeah, it's a stump question, right? Right or wrong, you're going to get the wrong answer. We can't give you the right answer as to what's best for you. So there is no best plan. What we do, though, is we look at, for supplements, the ratings. When it comes to the Medicare Advantage plans, as a supplements, right, we look at B+ more ratings. For our Medicare Advantage plans, we're going to look at what network they have, how easy is it to get in and out of the doctor in regard if they have referrals or not referrals. Are you in need of comprehensive dental? What's their formulary? Do you need to have, if you have a chronic disease, do you need to see a lot of specialists? Are you a candidate to hit that MOOP? Because if you're likely to hit your MOOP every year because you have multiple doctors, and yes, we do have people where it may be better for them not to get the Advantage plan and go ahead and pay that premium because they go to so many specialists and have to get so many labs. We're going to say, it might be best if you go with a supplement. I'm not saying that's the best plan for you, but based on what you're telling me, it may be better if you go with a supplement because you don't have any out-of-pocket expenses when you go to all these specialists or getting the lab work, and you're going to this doctor, that doctor, and it's certainly not a slowdown in your visits. But on the other side, if you're someone who wants to keep that expense low, use your money as you need it, I'll take care of it when it comes. That's the idea for the Medicare Advantage. I don't mind using a network as long as I have access to this group of doctors or access to that group of doctors. I'll take the Advantage plan. Give me the perks. Oh, it includes a gym membership and dental. Sure, I'll take that. It really depends on what you feel is best for you. And that is what we do, is we find out what you have, what are your expectations from Medicare. If I don't understand what you expect to receive, I'm not going to do a good job of helping you understand if you should go with the Medicare Advantage or if you should go with the Medicare Supplement. Now, That's how we help you choose the plan. We're going to look at your budget. We're going to look at your health. And so when someone says, hey, agent, you gave me a lot of information. I just want to go with the best plan. Which one do you think is best? I'm going to have to flip that question back on you and say, well, let's talk about this. And I'm going to talk about, again, your doctors, your prescriptions, your chronic diseases. What is it that you plan to do in 3 months? Are you hitting on a plane? Are you a cruiser? Do you hop your car and run the coast, or do you hop on a boat and run the coast? Do you fly a lot? Are you pretty much staying home? Do you only go to the doctor when you're really, really sick? Because if you're only going to the doctor when you're super sick, you might not need a supplement. An Advantage plan, because it's a use it as you go kind of plan, may be right for you. But again, that's going to be based on our conversation. So let me close this out and wrap it up. A Medicare Supplement plan is a plan that pays after Medicare pays. It has a monthly premium. It's standardized, which means a plan G is a plan G, a plan N is a plan N, a plan B, a plan L, a plan K, a plan A. Don't go with that unless you're under 65. Those supplement plans are all the same. The premium will be different based on the company you choose, which we call carrier, and your zip code. It pays after Medicare. They bill Medicare first, and then they bill the plan. A Medicare Advantage plan, it has a network of doctors. There's HMO plans, PPO plans, point of sale plans. Again, it depends on where you live in your zip code and what carrier is there. These are big national companies that we represent. You've all seen them on TV, but I can't go over those things on the video. You got to have all the copyright rights. So we have all the national carriers. You've seen their commercials. And it depends on the zip code to what benefits are available. Your trade-off is you have a very low monthly premium, if any, and you have a small copay when you use the plan, but you're going to use their networks unless you choose the PPO option, which means you'll have a higher copay. But it does have a cap, meaning not that they cap you and say we can't give any more protection. That's not what that means. It means you spend enough money, now the insurance company is going to pay the rest of the Medicare year. And in most cases, those come with Part D. Now, for my veterans again, thank you for your service. Thank you. If you're a veteran and you go to the VA, you can talk to us about a Medicare Advantage plan without prescription drugs, or you can get a supplement plan. You won't use those at the VA. The VA cannot bill Medicare. When you go to the VA, you use their benefit. When you go outside of the VA, you use the other benefit. If you're on TRICARE, it's not recommended that you pick up either of these. But if you're on TRICARE, some will choose a Medicare Advantage without drugs, right? Because your TRICARE plan has a great drug plan. But a lot of people do choose that hospital indemnity, and they choose the cancer, and never forget the dental, because what does Medicare not cover? Dental. And with that, I'm going to leave you guys with a smile. I encourage you guys to send your questions, message us. If you liked this video, if it was helpful, if it was simplistic, if it made sense, please comment. We love reviews. If there's something you want to learn about and you don't want to talk to an agent about it, that's cool. I'll talk to you. Send me a message. Send us a message. I'll love to. I'll do a video about it. If you have a suggestion, we want to hear from you. This is the new way of communicating, folks, and we love to talk. So leave your comments, call us. If you have questions, whatever, get a hold of us. We're here for you. Again, your friends from Trusted Senior Specialists. We love what we do, and we're safely doing it for you. You guys, I hope you have a great weekend. See you soon. I really don't know how to get out, but I'm going to try. Have a good day.